It's Carla, your online doctor, with today's Live in 5. Today is Friday, October 30th at 5 p.m. So, happy Halloween tomorrow to all of you trick-or-treaters. Also, it's fall back tomorrow, right? So, I guess between Saturday to Sunday, the clocks fall back. Yay! Because it's been super dark in the morning. And I don't like that because I get up early to play tennis some mornings and it's dark. So it's going to be nice. But let's keep talking, okay? And let's finish out the week. So trials for the use of convalescent plasma for COVID-19 treatment may be falling short in their phase 2 trials. Some of them actually may have already been stopped. So there's one study that was done in India. It was done on over 400 patients. The evidence suggests the plasma collected from COVID-19 survivors contains receptor-binding, domain-specific antibodies with potential antiviral activity. Okay, so those are all the things you want. You want it to be specific and be able to bind to the virus and potentially neutralize it, right? So the effective titers of antiviral neutralizing antibodies, the optimal timing for convalescent plasma treatment, optimal timing for plasma donation, and the severity class of patients who are likely to benefit from the plasma still remain unclear. We're not quite sure how all of that should be done to optimize the situation for the person receiving it, the recipient. So for example, if the donor donates right after, let's say 2-3 weeks after they have gotten the infection, are their antibodies at the highest? Are they the most effective? Or should you wait a month or 6 weeks? Or, so that is important to know when they should be donating. And then again, who is receiving it and when? So, the benefit or the belief is the plasma may reduce viral load, hospital stay, and mortality in the patients who are receiving it. But most studies have been halted. Like I said, the study that was done in India was actually one of the first randomized controlled studies to actually be completed. Now, the 464 patients had to be PCR COVID positive. Okay, first of all, so they had to test positive. They had to have a respiratory rate of greater than 24, indicating that they're having some respiratory involvement, and an oxygen saturation of less than 93% on room air, okay, without supplemental oxygen. So they're definitely having a significant respiratory event that would put them in that category. Now, patients were randomized to either get a standard of care, which was the control group, or the standard of care plus 2 doses of convalescent plasma 24 hours apart. Now, the patients were tested for neutralizing antibodies on day 0, which is this before, day 3, and day 7. And what happened was they found no difference after 28 days of those that progressed to severe disease or died. But in the less ill patients, at day 7, those given the plasma were significantly less likely to have symptoms. Okay, so the symptoms of fatigue, shortness of breath specifically, were much improved, and many were already testing COVID negative. Okay, so again, this is in the group of people who were less sick. So is that suggesting convalescent plasma is not going to be beneficial for those who are in dire straits, who really need something to help? It may be too far gone at that point, and maybe this is more beneficial to somebody who just needs a little extra boost, right? So the study was not blinded, meaning, so the patients knew if they were getting plasma or not, which can make it tricky because some of the questions were subjective. Do you feel like your fatigue is less, or is your shortness of breath less? Well, if you know you got the plasma, you're supposed to say it's less. You know what I'm saying? So that's concerning, but the objective points, like the negative COVID test, well, that you can't fake, right? And in that case, they were 20% higher. A negative COVID test was 20% more likely in the group that got the plasma over the group that was just the control group that did not. So there is definitely some benefit, but maybe, again, in the less severe illness group. Now, the researchers did report that receiving plasma is also pro-thrombotic, meaning it can help form clots, which may be a concern considering COVID-19 can result in life-threatening thrombotic events in some people. So that is also a concern. Now, a study of 20,000 U.S. patients who received convalescent plasma excluded many cardiac and thrombotic events deemed unrelated to the plasma transfusion. How that was determined, I have no idea, but that's a lot of people to be excluded. It was a high percentage were excluded, even though they had thrombotic events, deemed not related to the transfusion. Now, those criticizing the India study claimed many units of plasma that were given had either very low or no antibody titers at all. And because it was given late in the course of the COVID disease, it may not have been of any use. Now, antibody therapy works best when given prophylactically or early in the course of the disease. And of course, there needs to be antibodies in the plasma, otherwise, what's the point, right? You're giving plasma, which may have some benefit, but you're not giving antibodies against COVID-19. Keep your plasma, don't give it to me, right? So, interesting information. Clearly those who are sick, really sick, and dying are the ones that could benefit the most from these type of antibodies, but it doesn't seem at this point that they're going to be the most likely to benefit. Sorry, I hate to leave the day or the week on a kind of depressing note, but the studies are continuing. The studies are going to continue and continue and continue because we need to just keep learning as much as we can about this virus to get a handle on it at some point. So Halloween, again, is tomorrow. Clock's back, fall back, so make sure that you remember that. Stay safe, wear your mask. I mean, gosh, it's Halloween. It's an easy time to wear one, even if you're an anti-masker of sorts. So anyway, I hope you guys have a fun weekend with family and friends, social distance, wash your hands, all that good stuff, and I'll see you on Monday for another Live in 5.